Identical twins. Definition: the odds of having twins are far greater than for any other type of multiple births. Around 90% of all multiple are made up of twins. The remaining 10% is with triplets and very occasionally quintuplets and more. In recent years, there has been a big increase in the numbers of twins being born. There are two types of twins, identical or monozygotic, one egg, and non-identical or dizygotic, two eggs, twins. Other names for identical twins are non-fraternal twins, and non-identical twins are sometimes called fraternal twins. How do identical twins happen? Identical twins forms when one egg has been fertilized by one sperm and the zygote splits into two. Identical twins can also occur when one woman has undergone fertility assistance and has had one fertilized egg returned to her uterus. If this egg then splits into two, an identical twin pregnancy can result. What increases the odds of having identical twins? Luck needs to be on your side. Identical twins do not run in families and can happen for any couple with any pregnancy. Women whose mothers or grandmothers had non-identical twins do have more chances of having non-identical twins themselves. Some families do seem to have a higher than average number of identical twins. When are identical twins actually formed? The stage when the egg splits. Though all identical twins are formed very early in pregnancy, there is some variation in exactly how early the fertilized egg splits into two. This can happen at the cell to stage on day 2, the early blast cyst stage on day 4, or in the last blast cyst stage on day into 2 will determine whether the fertilized egg will implant in the uterine wall. The stage at which the egg splits will also determine if the babies have their own amniotic membranes and placenta or if they share. Essentially, the earlier the egg splits, the more independent each twin will be by having their own amnion, chorionic and placenta. How will I know if I have conceived with twins? Mothers are not initially aware that they have conceived with twins. It's not until twins may suspect it because of the intensity of pregnancy symptoms, or if they have been diagnosed through ultrasound, that a couple may know that they are expecting twins. Is it obvious at birth that twins are identical? Even at birth, it can be difficult to be sure if twins are identical or non-identical. Identical twins can still be born with their own set of membranes, and this is not a maker for them to be non-identical. The only way to be 100% sure is to do DNA testing on each twin and see what genetic information they share. This can be done in the early neonatal period by taking a swab of tissue from inside each baby's cheek. This is painless and non-invasive. What are the risks of having identical twins? If the identical twins share a placenta, they are at a higher risk of having twin-to-twin transfusion syndrome. This often results in one twin gaining more nourishment than the other and having a higher birth weight as a result. Umbilical cord entanglement and compression if the twins share an amniotic sac. Thank you very much for watching this video. If you like this video, do click on the like button, share this video on Facebook, Twitter and WhatsApp, and don't forget to subscribe our channel. Thank you.